Doctors Go Live. I am Nina Sharil Khan, and today we are going to be talking about what more can we do about dengue. Because I don't know about you, but dengue is a huge problem in Malaysia, right? So, what more can we do? How can we get ourselves updated? Today's episode is all about that. All right. So, if you think this episode is important and you want to share this out, please do. You can also take part in today's Doctors Go Live quiz happening right at the end of the Q&A, where you get to win some exciting prizes. And today's prize is really awesome. You get to win a laptop bag. How cool is that? You can never have enough laptop bags, all right? So I definitely am excited to win one, but I can't. So make sure you do, all right? So all this is happening right here on Doctors Go Live with me, Nina, and our special guest for today. So dengue. Dengue is a serious viral infection that affects millions of people worldwide, especially in tropical climates like ours. It's a disease that can cause severe symptoms, and it's actually life threatening complications if not treated early. All right. But with the right knowledge and preventive measures, we can definitely reduce the risk and protect ourselves and our communities. And that's what we're going to be looking into in today's episode of Doctors Go Live. Now, we'll be joined by our very own expert, consultant internal medicine physician, Dr. Wendy Chong from Columbia Asia Hospital, Petaling Jaya. So if you know someone whom this info would be super useful, there she is, right? Thank you for joining us, Dr. Wendy. Right. Before I just want to remind, before we start our interview with Dr. Wendy, I just want to have a couple of reminders. Number one, if you find this information really useful, please do share it out, because it can make a difference to our community out there. And number two, if you have any questions, please let us know in the comment, and we'll address it at the end of my questions with my interview with Dr. Wendy. And of course, please do pay attention to Dr. Wendy, because she has all the information for you to win in the quiz later, and you get to win a laptop bag. All right. So, Dr. Wendy, are you ready?
Can't wait. Very honored to be given this chance to actually share my experience and also hear from everyone. Hope today can be an interactive session.
Awesome. Fantastic. All
Yeah.
right. So before we begin, yeah, Dr. Wendy, could you share with us a little bit about yourself, what you do, and how you got started as a dengue expert? I didn't know there were dengue experts, but please do share with us.
Okay. I'm Dr. Wendy. I'm an internal medicine physician from Columbia Asia, Petaling Jaya. So how I got started even as a doctor, because during my younger days, I often have asthma attack and also lung infection. So to me, hospital is the safest place on earth since young. Hence, I pursue my interest in medicine, and also I had family members that admitted for dengue fever. And during my younger days as a doctor, I was trained in a hospital that have high numbers of dengue. We are talking about maybe per night we have 50 to 100 admissions of dengue. Hence, we have to be very vigilant in recognizing dengue, from mild dengue to moderate dengue. So we were forced to be very vigilant in the management, especially when we have limited doctors and high numbers of patients. So I'm really grateful with my training from the government sector last time, especially in Kelantan Hospital and also Hospital Sedang. Yeah, that's why dengue has a special place in my heart, because during my past years as a doctor, there are a lot of admission of severe dengue, especially the pregnant lady and also elderly. So previous years there are a lot of death rate among the dengue patient, but because of the um, vigilant training from the government side, and also working closely with the private clinics and also private hospital, hence we able to see the mortality has reduced, and especially with the introduction of vaccine nowadays, so we are able to bring down the mortality rates of dengue. Yeah.
Wow, I did not know there were vaccinations for dengue. So I think we're going to cover
Yep.
that today. Yeah. Okay. Cool. So,
Uh,
Doc, since you are an expert in dengue, why is it important that we discuss today's topic? What do you hope the audience will take home?
Okay, so number one, during the previous years, whenever people heard about dengue, they will have all the anxiety and they are worried of, the misconception of as long as you got dengue, you will have internal bleeding, you have to get admitted to ICU. All this is because of lack of awareness and education. But nowadays, better education on how we can actually take care of ourselves with mild dengue symptoms, and also how do we know when is the time to actually seek help from professional, when to go to a hospital, and also how can we prevent from getting a second dengue, and even vaccination among the people with higher risk factor of getting dengue. So all this can actually help to bring down the risk of, and also and this able to reduce the mortality among the society, and also reduce the hospitalization rate among dengue patient. That
Okay,
is
got
what
it.
we wish to bring to the topic today.
Okay, great. So basically, there's a lot of misconceptions happening out there about dengue. So how can we do more? Is to equip ourselves with knowledge and
Yes,
understand it
yes.
better, so we can protect ourselves and our family better. Is that right, Doc?
Yes, and we also hope to share with the community on when you are coming to a hospital, what is the anticipation, and what are the things to be expected, what are the tests that doctors going to do to you all, and how we as an individual can do to actually help to contribute in recovering from dengue infection. Yeah.
Okay, got it. Fantastic. So I think let's go to the slides then. Before we even start, what exactly is dengue, Doc? Can you
Okay.
briefly explain what dengue fever is and how it spreads? So let's
Okay.
take a look at the slides. Okay.
Now, the first topic today is what is dengue? Now, dengue is a viral disease that is actually transmitted to human by the mosquito called Aedes mosquito. So, what happens is when a mosquito bite on a human, the dengue virus get inside to the white blood cell and tricks them to actually produce more viruses, and this will spread to the body and affect multiple organs. That is why sometimes the patient come in to us, we will tell that the liver enzyme, the blood test shows the liver enzyme temporarily raised is because of the virus. So some of the patient, when they heard of, oh, how come my liver get affected, doesn't mean that your liver is permanently damaged. Usually it is just a temporary phase because of the dengue virus causing the temporary raise in liver enzyme, but with adequate treatment, it will actually improve. Now, there are actually four types of dengue viruses. Okay, they are dengue then 1, then 2, then 3, then 4. All these four actually causing similar symptoms and also causing the same illnesses as well. So when you got infected by one type, you will get the immunity from one type, but you're still at risk of getting the second type and third type. Hence, for any individual, so we are at risk of getting maximum up to 4 times of dengue infection in our life if we are exposed to 4 types.
I
Yeah.
see. Okay, okay. What determines the type of virus, whether it's one, two, three, or four? Just wondering.
It really depends on the mosquito that carry the type of the dengue viruses. Of course, it depends on the epidemiology, the location. And sometimes with the dengue vaccine, we can actually prevent the dengue for developing more serious complication.
Okay,
Yeah.
got it. All right. So how does it spread, yeah, doc? This dengue.
Okay, so dengue viruses are usually spread through the mosquitoes, which is the Aedes mosquito. So, of course, the incubation period will go up to 8 to 12 days. And also, other methods of rare transmission, such as if let's say a mother is pregnant, and so happen the mother is infected with dengue infection. So, there are the possible risk that the mother might transmit the virus to the fetus, which is inside the mother's womb. So this is one of the mode of transmission other than mosquito to humans. Yeah.
Okay, got it. Um, so next year, doc, how serious is it exactly? These diseases that are spread by mosquitoes.
Okay, so actually, as you can see here, the mosquito-borne disease are killing up to 1 million people per year. And also,
That's a lot.
Aedes, Yeah, that's a lot. And this mosquito, which is called Aedes aegypti, they also transmit other viruses such as chikungunya virus, which is also similar to dengue virus, but it is a different type of virus. They have later I will elaborate what type of symptoms that caused by different viruses, and also
Mm-hmm.
of course Aedes mosquito also carries other viruses called Zika viruses. So of course you
Wow.
can see that it requires blood to lay the egg. And they feed during the daylight and also bite, especially during the dawn and dusk. Usually, it's 2 hours before the sunrise, sunset, and also 2 hours after the sunrise. So later, I will elaborate in the subsequent slide on when is the peak time of the dengue beating time.
Okay, got it.
All right.
All right. And this is also increasing, is it? Doc, why,
Yes.
the breeding time?
Recently,
I
they
thought it'll
are
be better, the more developed we are. So what's happening, Doc?
Okay, of course, during the pandemic, we noticed that because of humans, we are not moving, not traveling, even the pollution also become less. But as the reopening phase after COVID-19 with international traveling and human trafficking, so of course, there are rapid raise of the dengue infection as well. And also global warming also plays important roles in causing the increased numbers of dengue infection in the recent years. And also the flood disaster also can help contributing in the increased cases of dengue infection. Yeah.
Okay, so that's what's happening. Yeah. So I would have thought dengue would be a thing of the past, but I guess not. So how exactly is it impacting us? Yeah.
Yeah. So dengue spread quickly around the world. And as you can see here, half of the world population in 129 countries are at risk of dengue infection. And almost 400 million of people are infected with dengue infection annually. It means every year, almost 400 millions of people get infected by dengue infection. And each year, there are 40,000 deaths due to dengue complication. Hence, dengue plays a huge burden globally. That's why it's very important for us as a community in finding way of educating ourselves how to prevent dengue and also how to prevent the complication of developing dengue complication. Yeah.
I see. Okay. Let's take a look.
Yeah, and also you can see here from the chart here shows that dengue is on the rising trend in Malaysia, especially every 3 to 5 years. So because each time whenever we have a dengue infection, usually the clinic and the hospital they will report. So of course, they will be fogging, trying to reduce the dengue transmission. Then we can see improvement. Then after 3 to 5 years, there will be surge of the dengue infection due to multiple reasons, especially due to the reopening and also traveling, causing the new surge again. That is why. Uh,
Okay, got it. And let's take a look at the next slide. What about this one, Doc?
So as you can see, not just dengue contribute in the hospitalization and also mortality. Dengue also cause student, loss in their classes, loss in their school day, 3 to 4 days of school. And also dengue also causing working adult to lose 7 to 8 days of working days. Hence, dengue infection actually impact in a lot of aspects in the society in
Hmm.
terms of workforce and also in terms of education. And also you
Okay,
can
got it.
see that dengue also plays a huge role in the economic burden. It can cause the health insurance need to pay up for the dengue fees and also whether is it in the public sector or the private sector. Hence, actually, dengue plays a huge economic burden. So, by actually educating us on ways to actually taking care of ourselves, reducing the case of transmission can actually improve in the economy and also social impact.
Okay, so
Yeah.
basically, dengue is a problem, kind of thing. Who would
Yes.
be at how let's have a look at the next slide. Who is at risk of dengue? Okay.
Okay, so the risk of dengue exists in the presence of places or country with these mosquitoes. especially Southeast Asia, which is one of the most serious affected country. So as you can see that dengue is endemic over 100 countries at least globally, including Malaysia. And Asia has the highest numbers of dengue. We comprise of 70%. Hence, Aedes mosquito thrive in tropical and subtropical region. And also we can see now dengue is even spreading in the new area, especially including Europe due to the reopening of COVID and also traveling. Hence, it is very important for us to actually bring down the cases of dengue by, carry out preventive measures and also vaccination.
Okay, got it. And who, in terms of people, who is usually at risk?
The thing is, no one can escape from getting dengue when you are staying in the endemic area. Even babies, elderly, even you are not, traveling outside. If let's say you have a family member which is infected by dengue and you have water that is accumulated inside the house, they can actually manifest with dengue infection as well. The mosquito can breed that. So no matter how healthy you are, how young or how old you are, or whether you are in a city or outside of a city, or any time of the year, we are at risk of getting dengue infection.
Okay, so basically it affects everybody, which is another misconception. But are some people more at risk or more at risk? I would say, wouldn't say prone, right? Are some people more at risk than others?
Yes, of course, when we talk about risk, some people having a more risk of getting complication of dengue, having a higher risk of getting severe dengue. Okay, especially for those that having a second episode of dengue. So if you have a second episode of dengue, you will have risk of getting severe dengue. And also
Mm,
for those that have diabetes or they have cardiovascular disease or asthma, they are at risk of getting severe dengue. So the definition of severe dengue means you will develop longer stay in the hospital, complication of dengue, sometimes might require oxygen, or also
mhm.
risk of internal bleeding is there, and even risk of death is there, or ICU admission. So especially dengue in pregnant women, they are also at risk of getting severe dengue as well. And also sometimes a dengue infection in pregnant women can cause preterm birth, low birth rate, and also fetal distress. Hence, everyone is at risk of dengue, but certain group are at risk of getting severe dengue. Hence, for this type of group, it is very important for us to actually carry out preventive measure and also encourage them to go for vaccination.
Okay, got it. I have another question, Doc. So if you're
Yes.
getting dengue the second time round, and then
Yes,
let's
yes.
there's four types of virus, right? If you get bitten
Yes.
the third, fourth, does it make it even more serious?
Yes, it depends on which type of dengue infection. Let's say if you're already infected with dengue dens 1, so
Uh
you will
huh.
get immunity from dens 1, but you are still at risk of dens 2, dens 3, dens 4.
Uh
You
huh.
can still
Right.
get infection for other type of dengue. And when you get a second type or a second time of dengue infection, second time around, you are actually at risk of may developing severe dengue. Not 100%, of course,
I
but the
see.
risk is there.
Higher.
Yeah.
Okay, got it.
Yes.
Okay, cool. Thank you. All right. So, Doc, so now that we know the seriousness of it, how do we know what are the symptoms? How do we know if we have dengue?
Very good and important question. All right, so of course, third out of four dengue cases, sometimes they do not have any symptoms. Sometimes they might have, mild fever, unwell. But a lot of time, the most common symptoms is actually fever, and also headache or pain at the back of the eye, and also when you have joint pain, or some they might see red rash over their trunks, their hands, their limbs, and also some they might have nausea or vomiting or diarrhea.
Okay.
So
Right.
actually in Malaysia during my younger days as a doctor, we were actually taught whenever you see a patient with fever, think of dengue first. Why? Because dengue infection carries a high risk of a complication. So whenever you have persistent of fever, think of dengue. Of course, sometimes not every fever case is dengue, but we should always make sure it is not a dengue. And later I will elaborate more on different phases of dengue and
Ah,
how
okay.
we can actually taking care of ourselves during the different phases of dengue. Yeah.
Okay, awesome. Let's take a look at the next slide. So these are the symptoms, is it, Doc?
Yes, yes.
Yeah.
So of course, some of the dengue infection, they might have mild symptoms. So the question now is, when do we need to go to hospital to check? When is the time to go hospital to check? Because dengue infection, sometimes when it is severe, we do not want to wait for too long until the complication arise, only we seek for help. Because that one we will be in life danger. So there is a symptoms called warning signs that indicate severe dengue. So whenever you develop all these symptoms, you need to go to a hospital or any clinic to get checked out. All right.
Okay.
To
Mhm.
check is it dengue or not, and also to check your condition. Do you need admission or not? All right.
Okay.
Because
Got it.
one of the complication of dengue is actually dehydration and bleeding. So these all can be checked from the blood test and also from the blood pressure checking and also heart rate checking in the healthcare uh, 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 center. So of course, the symptoms, number one is persistent vomiting. Number
Mhm.
two is persistent diarrhea, keep having diarrhea. And also whenever you have pain in your tummy or stomach pain, And also the other one is bleeding, bleeding from the gums, bleeding from passing motions. And also you feel extremely tired or restless or even having fast breathing or even vomit blood. All right. So if you develop any of the symptoms, go to a hospital straight or go to any nearby clinic to get checked up. If you are not sure, you're just feeling very weak, very poor appetite, you also can go to a healthcare center to get yourself checked. It's better to be aggressive and overtreat rather than be sorry. Because
Right.
dengue carries a risk of complication. Of course, I'm not here to scare everyone. Just that
Mm.
sometimes dengue cases, they are on the rise. So it is very important for us to be vigilant to picking up the symptoms and also to carry out a safety measure. Yeah.
Okay. So basically, be very vigilant. If you have a fever, better be safe than sorry, kind of thing. Yeah.
Yes.
Okay, got it.
Yes.
Let's take a look at the next slide. So, what is this slide about, yeah, Doc?
Okay, so the thing is, mosquito, they are not just carrying the dengue viruses, they also carries other type of viruses
Mm-hmm.
that
What you
similar to dengue,
mentioned
they are
earlier.
not dengue, but they are
Ah.
also viruses that carried by the same mosquito. All right, so there are
Mm-hmm.
viruses like chikungunya, also similar to dengue, but they have more of joint pain. They seem they have fever, and also there are other viruses like Zika or even malaria. So all
Mm-hmm.
these viruses that is carried by the mosquito, they have a similar symptoms.
Mm-hmm.
But for dengue carries a more serious complication. Of course, malaria also carry a serious complication. But malaria is usually involved in people that have recent traveling to the endemic countries, like India and all, or
Mm-hmm.
Africa. So sometimes the doctor will ask for any recent traveling from the patients. Yep.
Okay. So you mentioned that these symptoms look sort of similar, right? So how
Yes,
can we
yes.
tell if how is it different from even COVID-19 kind of thing?
Okay. So of course, today the topic today is about dengue viruses. So of course, we need to discuss of other virus infection.
Mm-hmm.
COVID-19 is also a type of virus, but it affect more of the respiratory tract infection. So whenever you have fever, you could have dengue virus infection or COVID-19 infection, but COVID-19 infection most of the time you will have cough, runny nose, which is called upper respiratory tract infection, upper
Mm-hmm.
respiratory tract symptoms. Okay, but for dengue, uh, very little patients they will have occasional sore throat and cough. Most of the dengue patient they will have fever and more of a gastrointestinal symptoms like nausea or vomiting or diarrhea or abdominal pain or tummy ache. These are all the common symptoms of dengue. As long as you're in doubt, just go to a nearest clinic and hospital and get yourself checked.
Okay. So now that we know that, so what is the diagnostic process for dengue for you
All
guys?
right. So when you are having fever, especially persistent fever, not improving, even with the medication that is given by a clinic, when you're having persistent fever, it's time to think of a virus. Okay, most common in Malaysia right now is dengue viruses. So when you come to a hospital or a healthcare center, so the doctor will usually order the test. Okay, so one of the tests is called rapid combo test, in which we will be detecting the virus and also antibodies in the blood. So this
Mm-hmm.
rapid combo dengue test, the result will be available, less than 30 minutes time. All right.
Mm-hmm.
So
Okay.
of course, uh, this is very useful in the early phase of dengue and also in the later stages of dengue as well. All right. So other tests that is more specialized, which is called PCR test.
Mm-hmm.
It is done when, let's say, certain cases they might have negative rapid combo tests due to sometimes of accuracy. A lot of factors plays a role, so they will do a more detailed PCR test. So this detailed PCR dengue test can differentiate primary and secondary infection, but this is the detailed test. If the rapid combo test give equivocal, means possible positive or possible negative test, then only we do the PCR, because PCR test is very expensive and it takes a longer time to have the result.
I see.
So there are two tests, but most of the time we will do the rapid combo test, which is available between 15 to 20 minutes time.
Okay, got it.
Yeah.
All right, Doc. So now that we know
Yes.
whether we have dengue or not, let's talk
Yep.
about
Yep.
treatment. What is the treatment for dengue?
Okay, the treatment of dengue depends on the symptoms and also depends on the stages of dengue. All right. So if let's say you're having mild symptoms, like let's say fever for 1 or 2 days, but you can still take orally, you can still drink well, you don't have any vomiting, don't have diarrhea, and you have appetite to drink yourself and keep yourself adequate hydrated, you can actually rest at home and take Panadol when you have fever. Of course, if let's say you develop persistent vomiting and you even can't tolerate orally, or you feel very unwell, or high spike fever and so lethargic, it is better to go to a hospital to get checked up. Because sometimes, right, if let's say you are not adequate hydrated, you are at risk of having dehydration and also internal bleeding in dengue. So hence, usually the doctor will actually take your blood to check your platelet count, your blood concentration count, and also check your blood pressure, heart rate, to determine whether you are the stable dengue or the severe dengue. Yeah.
I see.
So of
Okay.
course, you all can self-monitor your own symptoms based on the symptoms that I have shown just now, which is the warning signs of dengue, which is persistent vomiting, keep having diarrhea, or
Mm-hmm.
feeling extremely weak, or you can't tolerate orally. Hence, it is time to go to a hospital to get checked up. All right. So these are the symptoms of severe dengue, which is internal bleeding. These were whenever you have what happened in dengue is whenever you have dengue infection, the pores of the blood vessel become bigger. So the fluid tend to leak out from the blood vessel. So this will predispose patient to have drop in the blood pressure, causing internal bleeding, and hence all this will cause a complication to organs. Yeah.
Okay, got it. So in severe cases, definitely immediately go to the hospital, kind of thing.
Yep.
Yeah.
Yep. Yep.
Okay. And this is you shared about the immunity. Is there anything else you want to add, Doc?
Okay, so like what I have mentioned just now is whenever you get a dengue infection, when you get the dengue infection dense one, so you will be protected from dense one immunity. So when you get dengue, but you are still at risk of getting dengue dense 2, dense 3, dense 4, so for every individual, we are at risk of developing maximum 4 times of dengue. Yeah.
You
So
know of anyone
whenever,
who got all
yeah.
four? Just wondering.
Rarely I hear people get all fours lah. Very
Oh,
rarely
got
lah. I have one patient. She get like 2 dengue infection within 2 months from the different virus infection. That's why she was actually very frustrated. But fortunately for her, she recovered from both dengue infection.
okay, not
Yeah.
severe lah for her. Luckily lah.
And there's one patient developed 3 times in a year.
3 times, 3 different dengues.
Yes. Yes.
So he just needs
Yes.
one more, and he's got a travel passport, I guess.
Yeah.
No, just
Yeah,
kidding.
but
Yeah.
pity him because he have to absence from his work multiple times, and also he
Yeah.
has developing phobia from dengue infection.
Oh, poor thing. Okay, got it.
Yeah.
All right. So we've talked about how to treat dengue. How do before, let's say we don't have dengue, can we protect ourselves from dengue or not? So how do you protect ourselves from dengue? Are there preventive measures that we can take to avoid?
Of course, there are protective way of protecting ourselves from dengue infection. So number one is use of mosquito repellent, and also you can actually avoid outdoor activities during the peak of dengue biting time, which is 2 hours after sunrise, which is around 7 to 9 a.m., which is the
Mm-hmm.
peak hours of having dengue infection, and also 2 hours before sunset, which is around 5 to 7 p.m. Okay, so especially during the peak months of dengue infection, try to avoid going outdoor activities during that period of months and also time. All right, so if let's say you are someone that likes sport, maybe you can go for a swimming instead of go for hiking during that time, only in certain months. All right, and also if you really wanted to go for hiking, then you can actually choose to wear long loose protective clothing, and also you can treat your clothing with insecticide, and also you can always check your house, and make sure there are no empty container that holds water. And also you can use a mosquito net, and also frequently use the air conditioning at home to actually protect yourself.
Okay, got it.
Yeah.
What about, are there any treatments available or vaccines, new approaches for prevention?
Of course, the research world, they are actually coming more and more innovative approach in dengue control. Recent development, there's a type of bacteria, in insect that is safe for human. So the strategy is actually to inject this bacteria in the mosquito, so that the mosquito carries the bacteria called Wolbachia bacteria. So these bacteria will actually compete with the viruses and suppress the viruses from reproduce in the mosquito. So this is one of the way. Of course, there are new methods in which they actually use radiation to sterilize the male insect. So whenever the male insect that is already exposed to the radiation, when they mate with a normal female mosquito, so the eggs that they produce is non-viable. So this can also help to reduce the incidence of dengue infection. And also there are more and more newer ways from the research center. They are ongoing, but one of the effective way right now is actually the
Vaccine.
WHO is actually encouraging dengue vaccine, because
Okay.
the dengue vaccine that have been developing over the years, and the latest dengue vaccine has shows to be effective to actually reduce the complication of severe dengue. Uh, of course,
Okay.
when you receive the dengue vaccine, doesn't mean 100% you will not get infected with the dengue, but it will reduce the hospitalization,
Okay.
reduce the complication of dengue.
So meaning you can still get dengue, but it will not be as severe as what
Yes,
it
yes,
would be.
yes,
Okay. How
yes.
long has the vaccine been introduced so far?
Okay. So actually there are different types of dengue vaccine over the years. All right.
Mhm.
But this dengue vaccine, in the recent years, they have actually done multiple studies, and actually they already brought introduced to multiple countries, and it is not something that is like very very new. It has been
Okay.
there for past few years already, and
Hmm.
they already have uh, uh, they have a lot of wide scale study on human beings. So far there are no reported complication, and
Hmm.
also but of course it is not brought into the it is not scheduled national at the national level, because of the cost is still it is quite the cost is one of the reason. But some of the in certain because I recently attended a conference that is held regarding the open ceremony of the dengue vaccine, and
Hmm.
this open ceremony actually supported with a lot of infectious disease consultants, even from the government side and private hospital side, and they have given feedback that they see the effectiveness of dengue vaccine. So the people that are interested in actually prevent themselves from getting serious dengue, they can consider go for dengue vaccine. It
Mm,
is an option. Of course, it is not yet a must to all. Of course, for those that above 4 years old, it is a very we encourage people to go for dengue vaccine. Of course, there are certain group are not suitable to go for dengue vaccine, which is pregnant lady, still not encouraged to go for this dengue vaccine, and also those that undergo breastfeeding is not suitable to be vaccinated, and also for those that is immunosuppressed.
mm. Okay, got it.
Uh,
All right.
Whenever you are elderly or when you have comorbids, so
Mm-hmm.
we really encourage for the high risk group to go for dengue vaccine.
I see. Okay. Yeah,
Yep,
that would make a lot of sense, actually. Yeah.
yep, yep.
Right. What about for communities or the government? Is there anything being done? Is there ways a community can help in protecting ourselves against dengue?
So of course, whenever we got a dengue cases reported from the clinic and hospital, so we need to actually notify the dengue cases in 24 hours. Okay, so the authorities and the agency, they will actually go for arrange a fogging at the dengue endemic area, and also
Mhm.
during the fogging session they will actually spray indoor and outdoor, and also they will do a larviciding, means they will use the sand granules capsule to put at any site, which is like a the any site that potential breeding container site, okay, that actually the container that contains water, so they will pour some the granules there to actually kill the eggs, and also they will actually do the residual spray, apply insecticide in the outdoor surface, the hidden area, especially condos. Sometimes they might even go up to the car park to do a spray, dengue spray, just to reduce the dengue transmission. Yeah.
I see. Okay, that's fantastic. Okay, so I think have we come to the end? No, we've got one more. All right. So what about
I
this
think
one?
this is
Yeah.
the last slide.
Yes. Yeah.
Okay. Yeah. Okay. Thank you for bearing with us during this, boring afternoon after a heavy meal. I'm sure
Actually,
everyone has been.
I'm going to correct you. I think it's not boring. It's quite interesting
Oh,
because,
really?
yeah, because I've highlighted like 18 questions, no, 19 now. Yeah. So it's
That's
interesting,
oh,
right? Because we didn't know about all this. So, but yes, disease surveillance in Malaysia. Can you share with us? This sounds so
yeah.
exciting, so like high level tech, you know?
Thank you for cheering us up and making this session so lively. Anyway, so whenever we have a dengue cases, the private sector and the government sector, they will have a notification, e-notification, and this will actually inform the authorities to go for fogging. So all
Mm,
this is done through the online system, okay? And also there for public, for general public, the education on dengue, there's a free website iDengue to actually educate our community and public on the uh, dengue prevention method, how to recognize dengue. So you all can go to this iDengue website to actually know more about this. Yeah.
okay. So iDengue website, yeah. So it's informative. Wow. Soon I wouldn't be surprised with data and AI, everything. It'll be at our fingertips. You can know which area are hotspots and stuff like that, and that kind of thing. Yeah. So again, Doc Jesse is saying it's really informative. Re Ayer is saying very informative and interesting, and so is Chia Guat Hua, very informative and interesting. Not at all boring. Yeah, kind of thing. Yeah. Okay. So, Doc, last few questions before we go to
Yes.
the Q&A, because there's a lot of you guys asking questions. That shows how interesting it is. So, Doc, if we were to summarize today's topic, what we discussed about, what are the key things we need to keep in mind? And in your experience, what are the most common mistakes that people make when it comes to this? And what is that one message that you want to give to people out there? So, we'll start with the first one. What, if we were to summarize today's topic, what are the key things you want people to keep in mind?
Next is how to recognize severe dengue or warning sign of dengue. Symptoms that you must go to a nearest clinic and hospital to get yourself checked. Number one, okay, persistent vomiting.
Okay.
Okay. Number two, persistent diarrhea. All right. Number three, if you notice that you have bleeding from your nose, or bleeding from passing out, urine, and also passing out your stool, or passing out motion, you're still bleeding, or even when you're having a fever, you suspect you have dengue and your period flow is heavier than usual, a bleeding episode, all right, bleeding tendency, and also, of course, stomach pain or abdominal pain or tummy ache. All right. And these
Okay.
are the warning signs of dengue. And also when you are unable to drink yourself, poor oral intake, because some of the patient, when they're having dengue infection, they will have very poor appetite. One of the patient
Mm.
even tell me they smell rice, also they feel like want to vomit. This shows that how poor oral intake they will be having. So sometimes
Okay.
by admitting this patient and give some IV drip will help to keep them well hydrated and also improve their appetites as well.
Mm-hmm.
And so these are the way that I want people to actually know. Or let's say you're having persistent fever, even you already visited to a clinic, you still having fever, do not hesitate and just go second time to see the clinic or another clinic or even go to the hospital to get yourself checked. Just make sure it is not dengue.
Okay.
Because if you're just having a fever that caused by your normal viruses, the symptoms might be mild. But if let's say this fever is caused by dengue infection, sometimes you will fully recover yourself, but sometimes it can lead to serious complication. Okay,
Mm-hmm.
just share one example, but I'm not here to scare everyone. I do not want to
Okay.
cause anxiety. During my younger days, when I was working as a houseman, so there's one case in which a young gentleman, around 30 plus, so he having persistent fever, but he do not want to go to any hospital. So he presented very late to us. By the time he presented to a clinic, he already bleeding everywhere because of internal organ bleed. So whenever he reached to the ICU directly, from the house sent to the emergency to the ICU, he keep bleeding profusely, and it is too late for us to do anything. We just keep transfusing. So the incidents for me is you know uh, very memorable. I cannot forget the incident. Hence,
Mm.
sometimes I feel that it's better for us to be vigilant rather than just observe and wait. It is a very
Mm.
simple test. You can just go to any clinic or hospital, just get yourself checked for the full blood count or dengue infection.
Mm.
So if it is negative, then at least we already make sure it is not dengue. Right?
Okay.
So this is the one of the key point that I want everyone to take home. Of course,
Okay.
most of the time, dengue infection should you should have full recovery. So not all cases presented to be so serious. So I do not want everyone to be develop over anxiety because of dengue infection.
I
So
think
they
what's
normally
important here is when you have a fever, take it seriously. Go and get yourself
yes,
checked and do it early. Because if it is dengue and if you catch it early, you can definitely recover easily and
yes,
effortlessly, right? Yeah. So
yeah,
instead of keeping it longer and longer, making it worse,
yeah.
just go to the doctors. Yeah. That way nobody gets a scare about and dengue is not so dangerous, I guess, right?
And also number two, the misconception that I wish everyone can actually re-educate yourself. Whenever you have dengue infection, doesn't mean that you have to get admitted to ICU, doesn't mean that you'll be very, very serious, very, very ill. No. If you presented early, you keep yourself well hydrated, and you get checked by a healthcare personnel, they have a proper education and teach you how to take care of yourself, like drink adequate of water, and also monitor your blood count, so you will eventually fully recover. And when you have a platelet that is very, very low, doesn't mean that you sure gonna be in life-threatening. No. Number one, don't panic. Get yourself checked from a healthcare professional, and also keep yourself well hydrated. If you are not sure, just get yourself to a nearest clinic or hospital. Alright. Of course, low platelets sometimes can indicate the seriousness of dengue, but doctor will look at other parameters as well, including the blood thickness, including the blood pressure, including because all this dengue treatment is based on the KKM clinical guideline of Malaysia. And also, we are
Mhm.
all trained to actually monitor the dengue. It is a standard treatment. So hence, don't no need to be too worried. If you're not sure, just get yourself checked, and also always seek for help if let's say you're having persistent fever that is not resolved.
Okay, got it. I think that's very, very clear. For you
Yeah.
guys who are tuning in at home, let me know in the comment what was the biggest thing that you learned from today's episode. And please do
Anyways,
share it with your friends, because at least we know that we're doing our jobs, yeah, and we're passing the knowledge on to you. So let us know in the comments right now. Okay, for me this has been super insightful. I would say the moral of the story is, you have a fever, just go and get it checked. That's it. Easy kind of thing, because you'll be helping yourself recover faster as well. Yeah. Okay, so we are going to go
can I
into
add on?
yes,
Can I
yes,
add
yes,
on one last point?
yes.
The other last misconception that I want to highlight to everyone is regarding papaya leaf,
Oh
because we
yes, I was going
see
to ask you
a
that.
lot of
Yes.
these patients, when they get admitted, their relative will bring the papaya leaf supplements, whether is it in bottles or is it in capsules. Okay, so whether papaya leaf derived or papaya leaf supplement, is it going to help with platelet improvement or dengue infection? The thing is, there is no wide scale study, and it is not recommended in the treatment of dengue,
I see.
KKM Malaysia, and also WHO. Of course, of course, there are some small scale studies say that it might improve, but the thing is, platelet will recover itself as the disease progress. All right, just as so happens,
Mhm.
some people they are taking papaya leaf, and then so happen they're in the recovery phase. We never know that. But of course, because the thing is, some of the patient, whenever they take the papaya leaf derived, right, not everyone can tolerate. Some they will have nausea because of the bitterness, and they will have vomiting after taking that. So that sometimes might cause risk to the patient that taking this. It is not totally cannot take at all, because papaya leaf won't cause raised liver enzyme or hepatitis and all. But without taking that, we can also treat dengue effectively. So it is not a must to take a papaya leaf, but we will not stop you all from taking. We just don't encourage lah, because not everyone can tolerate this. And sometimes one of the side effect is it might cause nausea and gastric after taking this. Some of the patients they have the symptoms. So in our
Okay.
dengue treatment, without taking this, also you will fully recover. Yeah.
Okay, got it. So that's the myth busted about papaya leaves. Okay. Since we're talking about this, let's go straight into the Q&A. And Momo has a question. The question is listed here. Doc, what about soup ketam? Boleh recovery dari dengue? Because I think that's the other thing, right? Soup ketam. So over to you, Doc.
Yes, of course. We have noticed a trend among Malaysians. So for Chinese, they will take papaya leaf. For Malay, they will take soup ketam. Okay, the thing is, these are all tradition method or supplement. There is no scientific research and enough wide range, large scale research to prove it is effective. But no harm trying. If let's say you do not have any side effect, we will not stop you all for taking that. And as long as you do not develop, food poisoning, and do not have any gastric. But one thing that one preventive measure or one safety measure that you all can do as an individual, because us doctors, we will take your blood, we will monitor your blood pressure, pulse rate, and everything. But you as an individual, you can help us by keep yourself hydrated. You can actually drink coconut juice, especially for those that do not have diabetes, because coconut juice they have solutes. They will, help in the nutrition, the solutes, the hydration, uh, and also you can have fruits. Fruits is actually recommended in the WHO for the general well-being in dengue patient, and also
Mhm.
keep yourself hydrated.
Okay.
How do you know you are well hydrated? Okay, because when we ask patients to drink more water, some patients they will be so kiasu until drink 5-6 liters per day. So actually, as long as you drink until the extent you see your urine become like light yellow, Light color means you're well hydrated. Around
Mm.
2 to 3 liters per day, for a 60-kilo man. Okay, you don't have to overforce yourself to drink too much as well, because we will give you a drip and will monitor your blood counts. All right, so you can keep yourself hydrated, have enough sleep, don't panic, be positive. Eventually you will have full recovery.
Okay, fantastic. Okay,
Yes.
so just checking on time, we are at 3:51. So I need to keep my promise to Dr. Wendy. So we're gonna choose our questions, and then we're gonna go into DNA. So Tan is asking a very important questions, which I don't think I know what the answer is. It is any difference between dengue, IgG, IgM, and NSI? What is that, doc?
Very good question. Very intelligent question. All right. So dengue combo test, it shows the dengue virus and also shows the antibody level. So usually when you are in the day 1 or day 5 of illnesses, means because dengue start with fever, So when you are at the first fever phase of dengue, because dengue there are 3 phases. You have fever phase, and you have the non-fever phase, which is the critical phase. During this phase, after you're having fever, on the day you're not having fever, but at day 5 or day 6, is the time that we need to be careful, because this time the platelet will start to drop. So when the time of platelet will start to drop, it's called a critical phase. Usually the critical phase lasts for 48 hours. So during that time is the most critical period, because most of the patient that will develop the warning sign, which is the vomiting, diarrhea, bleeding tendency, blood pressure will drop. So during that time, we'll monitor the platelet. So the platelet will drop to the lowest. Once the platelet drop to the lowest, if you keep the patient hydrated, the platelet will eventually rise up and go into a recovery phase. So when we see the blood counts, when the platelet is going up, the white cell is going up, this is a time where we can actually relieve. So, what is the question again?
The difference between dengue, IgG,
Oh, okay,
IgM,
sorry,
and
sorry. So I
NSI.
got
No worries.
taken away. Okay, so during the dengue phase, the initial test that shows positive is NS1. So NS1 were positive at first day to the fifth day. So at the fifth day, the NS1 will be negative. Sometimes they will be negative, and then the dengue IgM will be positive after day 5. So dengue IgM will positive after day 5. So eventually, when the patient fully recovered, so dengue IgM will be negative and dengue IgG will be positive. So all these tests shows the virus that is positive or antibody that developed after you recovered.
I see. Okay.
But you
All right.
don't worry, if you are not sure, you just go to a hospital. The doctor will interpret and explain to you.
In layman terms.
Yes.
Brilliant questions, though, Tan. You got us educated even more. Okay, next question is by Chia. There's a few questions, so let's keep the questions short. I mean, the answers short and sweet. Chia is asking why some patients have hemorrhage and some don't. Are there certain genes more prone to hemorrhage? And then another question is from Ree. Doc, if someone has dengue 2 years ago, how would the antibodies level be? I'm assuming, do you get it for life? Yeah. So yeah, whichever you want to answer first, Doc.
Very
Hemorrhage.
good question.
Mm.
Okay, so
See,
for
that's
the first
interesting.
question is, yeah, why some patients they have hemorrhagic and some don't? So which type of genes are more prone to hemorrhagic? So number one, it really depends on the risk factor of the patient. If let's say patient, let's say they already have underlying heart problem and they are on blood thinner. So when they are blood thinner, the risk of developing bleeding is there. So of course, when they develop, the risk of developing hemorrhagic dengue is also there. Or for those that have second times of dengue infection, they were also prone to develop hemorrhagic dengue. And of course, there are certain genes that are more prone for dengue viruses. But unfortunately for today, I forgot to, because a lot of times every recent years they will have research on which genes they have more hemorrhagic episode, depends on the data collection. If not mistaken, I remember is dense 4 is the most severe one, dense 1 is not so serious. But let me just counter check and I will update you all later.
Okay.
But usually Whenever you have dengue infection in a hospital setting or clinic, we do not check for the dengue genes. Why? Because by checking the dengue genes, it's very expensive. It's around thousand over ringgit to do the dengue PCR test to see what type of dengue dens there, and the treatment is the same. So even you have the genes that is more severe doesn't mean 100% you will get hemorrhagic. No, only certain people. So it is not cost effective to check dengue genes for all patients because the treatment is the same, and sometimes you do not have severe symptoms despite that. It depends on individual factor. If let's say you have that gene but you go early to check yourself and you keep yourself hydrated, so you
Mm.
will reduce the risk of getting complication.
Okay.
So of course, yeah,
Okay.
so
So
it really depends on multiple factors as well.
okay, got it. Okay, let's go to Ree's questions. Someone had dengue 2 years ago. What would be the antibodies level now?
Okay, this is a very good question. So usually when you have dengue 2 years ago, right now you do not have any fever, do not have any new infection. When you check yourself, you will see dengue IgG will be positive. So means this is past infection positive. So if let's
Mm-hmm.
say you have no fever and you go and check your dengue test and you see dengue IgG is positive, IgM negative, NS1 negative, it just mean that you have past dengue infection. Right now, you do not have dengue. You do not have dengue acute infection.
Okay, got it. So basically, the antibodies will be there for the rest of your life, right? Does it go
Yes, yes.
down or up? I think that's what he's asking. It's the same, right?
Um, of course, you can go and check for your dengue antibodies. You can if
Mm-hmm.
let's say, especially when you go for vaccine, you want to check for your dengue antibodies. There are tests to actually do that. But whether on uh, how much drop in the antibodies right now, the data, the research work, they are still collecting. But one thing for sure is the recent dengue vaccine is effective in reducing the hospitalization and also complication of severe dengue. This is one thing for sure. Number two, whether or not after you get the dengue vaccine, you need to take another booster for dengue vaccine. This is still under the research study. So we shall wait for the next recommendation that will be published later on by WHO and all. But what
All
we
right.
can do as an individual is get yourself checked, and if you can, you are at risk, go for dengue vaccine.
Okay. Just one more question. Which Chia's question is, what is NS1 mean and how long does it stay in the body? I think it was already answered by Dr. Wendy earlier, so we'll let
Yes.
go of that question. Yeah. Okay. And I think let's quickly go. It's already 3:58. Let's quickly go to our quiz question. All right. So if we can have the quiz slide on, it is quiz time. And as mentioned in the earlier part of the show, we have some laptop bags up for grabs. So first, what do you need to do to win? First, be sure to share this video out at least 3 times, and remember to set the share post to public so everybody can see. Next, answer the 3 questions that we're going to be showing on the screen in a single comment, and you're on your way to win the prizes. You don't need to type so many times; once is enough because we can see you. All right. So how do you win? Share the video out 3 times. Remember to set the post to public so everybody can see the post. Secondly, answer the 3 questions that we're going to show on screen in a single comment, and we will select the first 3 winners based on the correct answers and shared post. So if you are ready, let's go with the first question. There are 10 types of dengue virus, true or false? There are 10 types of dengue virus, true or false? Dengue virus can be transmitted by any mosquito. Is that true or false? Dengue virus can be transmitted by any mosquito, true or false? And last question is, only pregnant women are at risk of dengue, true or false? Only pregnant women are at risk of dengue. So please write down your answers in the comment in a single comment. And then while waiting for the winners, let's go to the Q&A once again. Yeah. Okay, so Jessie Liu has a question. Her question is, uh, let's see. So incubation period is 2 to 8 days. We've already answered this, so we're going to go to the next one. Yeah, Jessie, I believe that was asked before we looked into the questions, but I'll ask another question from you. So does the virus cause other complications after we recover, or it remains dormant if not completely wiped out by the body? I think this is a brilliant question. Does it get completely wiped out by the body or not, Doc? Yeah, okay. I can't hear you, Doc.
Are you able to hear me now?
Yes, I think you were accidentally muted.
All right. So it depends on the how early you present to the healthcare center. If let's say you presented early before the complication arise, you get your baseline blood check and the blood pressure all is stable, usually you will fully recover without any complication. But it's in certain cases of severe dengue in which they presented very late, they already have bleeding from the stomach. So the complications is same like any other severe infection, like severe lung infection or severe bleeding infection. So sometimes if let's say you develop bleeding due to dengue, so the doctor might need to do scope. So when you are admitted to the hospital for prolonged days, you are at risk of getting hospital secondary bacterial infection or complication for prolonged intubation. So the complication is the same. But if let's say you do your part, you get yourself checked, keep yourself hydrated, usually you will fully recover without any long-term complication. And usually the virus, once you recover from dengue, so you will recover from the virus infection, means the virus is no longer active after you reach to the recovery stage.
Okay, awesome. Next question is from Nur Diana. Is it true that mosquitoes are more attracted to a certain blood type, in this case O, compared to other blood types? Just wondering. Are there certain people who get bitten more tendency? Because I think I always get bitten by mosquito, but that's just my theory. So let us know, Doc.
Is it true that mosquito are more attracted to blood type O? Of course, there are some saying, but it is not because it depends on what type of mosquito and what type of illnesses as well. And also depend on multiple risk factors. So the thing is, it is not strong yes, it due to a lot of factors, but what we can do is whether you are type O, type A, type B ke, you as long as you try your best in getting yourself checked and carry out preventive measure, then you will be fine.
Okay, fantastic. This is a very simple question. Is it normal to have mild dengue without knowing and recover without treatment? Is that possible?
Yes, yes,
Okay,
yes,
there
yes,
you
it
go.
is
So
possible, it is
you
possible.
might have antibodies and not know it. So that's brilliant.
Yes. Yes,
Yeah.
yes. Because sometimes I have patients, they come to us because they don't really feel feverish. They just feel a bit of unwell, a bit of warmness, maybe low-grade fever, and their platelet never drop. So in mild dengue, you will not have drop in platelet and you will fully recover after 5 to 6 days. But when you are, elderly, it is better to be vigilant and just get yourself monitored closely because when as we age, right, the risk of us getting complication is always there. Yeah, that's why.
Okay. All right. So the last few questions I'm going to ask because we've already got the winners. So Jesse's question is, since it's caused by virus, and I suppose there's no cure for dengue, then we just treat and manage it. Is that what it is?
Um, okay, it is not a correct statement, but it's a very good question to be brought up. All right. Number one, when you have dengue viruses, the thing that we are worried here is dehydration and internal bleeding. So when you have dehydration, some of the people they just can't drink adequately because they have very poor oral intake or they keep vomiting until they will go into dengue shock, BP drop. So all this require treatment, which is the IV drip hydration. Doesn't mean that you admitted just hang a drip. No. Doctors usually will take your blood, you will see your platelet count, you will see your blood thickness, and we will do our calculation to calculate for you how much fluid you need. Each time we take your blood, we will correlate with the dengue stages, whether you are in fever phase or critical phase. We have to calculate the drip based on the per body weight. Too much fluid is not good, too little fluid is not good. So each time you have to take your blood, correlate clinically, and give you the adequate amount. So this is the treatment of dengue. Of course, this
Okay.
is supportive treatment, but this is the ultimate treatment. And of course,
Mm,
if patient able to drink themselves, it is also good. So we will calculate how much the patient drink, and then how much fluid we need to give. Hence, this is the treatment. But of course, when you say cure, uh, the definition of cure, it really depends because it is not like you having a bacteria, you give antibiotics. For
mm,
viruses, you don't have an antiviral for dengue infection. It is more of a supportive treatment They will
for the
help to make
symptoms.
sure patients stable.
Okay, got it.
Yeah.
Brilliant question, brilliant answer. Thank you so much for asking that question. So the last questions, I'm going to group a couple of you guys because it's all to do with the vaccine. Okay. So the first question is from Chia. Is the vaccine, can it cover all the four types of dengue? How long will the antibody last? I think Chia, very interested to know how long the antibody lasts. And then Jesse's question is, where can we get the vaccination? Is it available in GH or do I go to private clinics? And how long does the vaccine last? Is a booster needed? So, yeah, so those are all the questions, which also answers Michelle's question. Vaccine is available. All right. So, does the vaccine cover all the four types of dengue?
This is a very, very brilliant question again. All
Yeah,
right.
it's
So
brilliant. He
it
keeps
really depends
coming back
on
with
the
amazing ones.
brand of the vaccine, but one of the brand, of course, I'm not selling dengue vaccine. I'm just promoting health treatment that is useful for everyone. All right.
Mhm.
So if let's say one of the dengue vaccine uh, one of the dengue vaccine, like just for example, like let's say a Q dengue vaccine, usually it lasts for 4.5 years, all right? And usually when you have dengue infection, so 2 months after you recover was dengue infection, you can start considering taking dengue vaccine. And the effect usually will last for 4.5 years, all right? And the dose of taking this dengue vaccine is 2 doses, usually is 3 months apart. All right.
Mm,
But of course, when you go for this dengue vaccine, you can always inquire more from the doctors or from the healthcare center. All right. They will always give you the adequate advice. And whether or not do you still need to take a booster, the booster trial is still ongoing. But for now, you can consider taking dengue vaccine. All right. So whether or not where is the availability of dengue vaccine, if not mistaken, I think for now it is only available in the private sector. But I'm not sure whether is it available in the government sector. We never know because sometimes they might bring it in sooner or later. All
mm.
right. But in a lot of private sector and private clinic in Malaysia, it is widely available. So you can inquire on it. Yeah.
Right. Okay. I think this is brilliant because you're such a you're involved in this whole dengue thing. You get all the latest information. I think this episode needs, we need to do ever so frequently so that we get the latest update kind of thing. So it's available in private clinics. Definitely, Columbia Asia does it.
Yes, Columbia Asia has dengue vaccine. You can call because
Good.
actually this is not just for the uh, because vaccination helps to prevent diseases and burden to the healthcare. You know, when more people go for vaccine, less people will get admitted to hospital for dengue infection, which is actually good for the society as well. Hence, this
Okay.
is why sometimes us as in a healthcare center, we want everyone to stay healthy. Instead of aiming not to get sick, we want everyone to aim to be healthy, strong, fit. That is why we're trying to aim here.
Yeah, and does it cover the four types, or you got to take four
Yes,
different?
yes. No, no, no. Just one type of vaccine is adequate to reduce the severe dengue.
Ah, okay, okay, okay. So, in other ways, it covers the four types, law.
Yes, yes.
Okay, fantastic. So that's the end of our Q&A because we already have the winners. All right. So who are the winners? Before I announce who the winners are, let me repeat. Let's go through the questions. Yeah. And I'm just going to answer it. So there are 10 types of dengue virus. Dengue virus can be transmitted by any mosquito. Only pregnant women are at risk of dengue. What is the correct answer, Doc?
There are only four types of dengue viruses. So this is the
Mhm.
FOS. Number one is FOS. And dengue virus can be transmitted by Aedes mosquito, not any mosquito, FOS. And also
Mhm.
three, only pregnant women are at risk of dengue, which is FOS also, FOS, FOS, FOS. Okay.
Great. Awesome. Because anyone can be affected by the dengue virus. All right. So the winners are the three winners are Muhammad MSMN. very interesting name. Chia Guat Hua, congratulations. And Sabrina Pai. So Muhammad MSMN, Chia Guat Hua, Sabrina Pai, congratulations. We will be contacting you either today or tomorrow to get your details. So be sure to check your Facebook Messenger. Otherwise, I get to keep the laptop back. All right. Okay, cool. Congratulations to all our winners. I'm afraid that's all the time we have for today. Doc, I'm sorry I took 11 minutes extra, but I believe this has been a really useful episode for all our viewers. Yeah. So we hope you learn a thing or two. And if you know someone where this information is going to be really useful, who's going to appreciate the tips, the insights from today's episode, please be sure to tag them and give us some love on our social media while you are at it. Thank you so much again. We hope you learned a lot from today's episode. Thank you so much, Dr. Wendy. So till the next episode, take care of yourself and each other, and we'll see you in the next episode. Also, let us know how you like today's episode, and if you want to see another episode with Dr. Wendy with an update of dengue and other things, because it keeps getting updated, right, Doc?
One last reminder, because I
Yes.
saw one of the comment, they are asking whether can breastfeeding mother take the vaccine. So of course,
Yes.
before you go for vaccine, you need to ask the doctor whether are you safe to take the vaccine? Is it any contraindication? So number one, dengue vaccine is not recommended for pregnant lady. All right. So try to get yourself vaccinated before you get pregnant lah. Number two, uh, for breastfeeding mother, it is not recommended for vaccine as well, for the dengue vaccine. Okay. And number three, for the immunosuppressed people, such as people that receiving cancer therapy, they're immuno low, or whether they, as long as your immunity suppression, you are also not 100% indicated to take. You have to ask the doctor to assess you first. So before you go for dengue vaccine, you need to tell your doctor your history first. But most of the time, most patients, whenever you are do not your immunity is fit, you are not pregnant, not breastfeeding, you can consider go for dengue vaccine when you are age above 4 years old. Yep.
Yep. All right. So this was the question which we missed out because it was all the way after all the answers are false. Right? Thank you so much for the question. And thank you for being such an amazing audience. We learned a lot today. So
Yeah.
if you would love to see Dr. Wendy again, please let us know in the comment and then we'll bring her here maybe next year. Yeah, kind of thing. All right. Thank you so much. We hope you had
Thank you,
a
everyone.
wonderful episode with us. Until next time. Bye.
Bye.